Meet Paula. Paula is the young single parent of a 3-year-old little girl, Jessica. Since having Jessica, Paula has had to move in with her mom, who watches Jessica while Paula is at work. Their family relies on Medicaid for health coverage because the restaurant where Paula works doesn't offer health insurance, and they don't make enough money to afford a private insurance plan. Paula received a postcard in the mail saying her Medicaid health plan would be changing. She was confused, so she went to the library and tried to learn more on the website, but there was a lot of information, and she had a hard time understanding it all. On one page, it said that primary caregivers were exempt, so she assumed that meant she didn't have to worry about her health insurance changing. A few months later, Paula receives a letter in the mail from the state telling her she has a penalty on her coverage and she can't figure out why. She tries to call the DCBS hotline, but she sits on hold for over an hour and is disconnected. Paula is furious. Paula has to take a day off work to meet with an assister to find out what's going on with her Medicaid coverage. Paula learns she is not exempt from the PATH community engagement requirement, even though she almost always works more than 80 hours a month. The assister explains that only one adult in each household can be exempt as caregiver, and that is Jessica's grandma in their case. Apparently, Paula was supposed to be reporting her work activities through an online portal she's never seen before. Paula's assister tries to help her create a Citizen Connect account, but they get stuck when she's required to have her ID verified online. Paula finds out she can't verify online because she doesn't have credit history. She has to call DCBS again and waits 2 hours on hold before getting help. Finally, Paula and her assister are able to create her account and submit proof that she's working, which she'll now have to do every month. Paula wonders how anyone would ever be able to do this without one-on-one help. Even though she's got her account straightened out now, the restaurant where Paula works keeps changing her schedule, and she has a hard time knowing how many hours she'll get each week, so it's almost impossible to plan anything else during the month. A few months later, Paula is still struggling to keep up with this new community engagement requirement. She's late reporting her hours one month and comes in short a few hours the next month. She receives a notice that she's about to lose her coverage. She feels like she's doing everything she can to make a living for her family, but these penalties are just making it harder. Even though she's still working as many hours as she can get at the restaurant, Paula knows it won't be enough to avoid the penalty. She tries to figure out another way to volunteer or take a class to make up her hours, but nothing is available at the last minute. If she doesn't have Medicaid, she won't be able to fill her depression medication, which would make it impossible for her to keep her job and be a good parent to Jessica. Paula feels defeated. She wonders how losing coverage is going to help families like hers become more self-sufficient.